is your Filipino radio experience in Las Vegas. PHLV Radio. PHLV Radio. The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Welcome to Healthy Mondays, brought to you by the Asian American Pacific Island Nurses Association of Nevada and PHLV Radio. Mabuhay! My name is Randall Sasa. I am an assistant professor of nursing at Queensborough Community College of the City University of New York, your guest host for today. I am filling in for my friend, Dr. Mary Faye Axon Armstrong, who is the founding president of Apina of Nevada and the host of this show. We are coming to you from New York City for this very special edition, where we will be talking about perspectives of nurses on the COVID-19 vaccine. We have an excellent panel of guests whom I will introduce to you in a bit. But before we begin, it is important to note that whatever discussion we have in this show should not be taken as medical advice. If you have concerns about the COVID vaccine, whether it's right for you, given your particular health status, you have to seek medical advice from your healthcare provider. Anyway, can you believe that we are in the second week of January? Ang bilis. Last week has been really challenging for us here in the US with the insurrection at the US Capitol. And we send our thoughts and prayers to those who were killed or injured. In particular, we mourn the death of Officer Brian Sicknick, who was killed in the line of duty defending the Capitol. The riots in Washington, D.C., however, has eclipsed the bigger carnage happening in the country, which is the COVID-19 pandemic disease. Last week, the U.S. has set a new record in terms of COVID deaths. So as of Thursday, January 7, we had on Thursday, I should say, we had 4,112 deaths in a single day. And as of today, we had over 370,000 deaths related to COVID and over 22 million cases and counting. To put that in perspective, it's like having the deaths in 9/11 125 times and counting since the pandemic has begun. But the good news is that the vaccine is out. On December 11, 2020, the U.S. Food and Drug Administration, FDA, has issued the first emergency use authorization, or EUA, for the COVID-19 vaccine made by Fisa. The following week, December 18, the FDA issued its second EUA for the Moderna vaccine. However, we have to bear in mind that vaccines by themselves do not save lives. Vaccination does. This practically means that creating the vaccine is just the first step. The more crucial step is to make sure that the public is vaccinated so that a critical percentage of the population develops vaccine-acquired immunity. New York City is one of the first cities in the country that saw a devastating COVID-19 outbreak. Now, it is leading in terms of the effort to vaccinate the public, beginning with healthcare workers and residents in congregate settings such as nursing homes. We are currently in the fourth week of that mass vaccination effort. We would like to check in with nurses in the field about their perspectives on the COVID vaccine. And so I would like to introduce our panel, Lynn Mendoza-Zilberman, Cassandra Lee, and Jack Say. So we will just go round robin. You will introduce yourself. Tell us about your nursing career, and what is your current nursing role? Lynn?
Hi, my name is Lynn, and I am a nurse educator. I've been a nurse educator for 5 years. I've been a nurse for 16 years, going to 16 years this year. My background is in critical care. I'm a critical care educator as well, and I work in a large academic institution in New York.
Mm-hmm. Hi, Lynn. And how about Cassie?
Hi, my name's Cassandra. I work at Bellevue Hospital for the past year and a half as a trauma ICU and ER nurse. That's about it.
Yep. On a side note, Cassie happens to be my student, one of my most brilliant students. To blow your horn, Cassie.
Oh.
And now she is a co-lead. So I mean, I'm old. I feel old. Anyways. And the gentleman, Jack.
Hi, yes, my name is Jack. I'm also an assistant professor of nursing with Professor Fisa here at Queensborough, City University of New York. Per diem-wise, I work at Bellevue Hospital as well, same location as Cassandra, at the medical ICU.
All right. So I understand that Jack and Lynn already received the vaccine. And so I will ask them first. Tell me when you were vaccinated, and did you notice any untoward symptoms that may be related to the vaccine? We'll do ladies first.
Okay, so I have to go first. Anyway, just as a background, I already had COVID back in March. I was one of the first ones who got hit. And at that time, we weren't sure if it was COVID or something else. I wasn't very sick. I lost my sense of smell, then followed my sense of taste, and that went on for roughly about 3 weeks. I spiked the fever for like 2 days, and that was it. Nothing much. At the time, it was sick. Although I was suspecting it was COVID, it was more troublesome to fall in line in a massive line in the ED to get tested. So I opted not to and just quarantine myself. And then a few weeks later, the hospital told us, like, why don't you do an antibody screen to see if you have been infected already? So that's what I did. And in May, it turns out that I had been infected and does have antibodies. So fast forward in December, December 15th to be precise, is the day that we rolled out vaccination for our hospital. And I was debating whether to get it or not, knowing that I've already had been infected. I already had antibodies. So what I did was waited a few weeks. I wanted to have like the frontline nurses to be the first one to get the vaccine. And then I was thinking to myself, like, look, if like the frontline staff already got it and they still have some doses left, then I'll gladly take it. So that's what I did. But before I did my dose, I went back again to our health services and got myself tested yet again for the antibodies. Out of curiosity, I just wanted to see like how long does the antibody really stay. So the day before I got the vaccine, they confirmed that I still have antibodies. So I called the clinic and asked them, look, I still have antibodies. Do I really need to get vaccinated? Because I don't want to get the vaccine that are intended for other people, like if I already had antibodies. And they reassured me that I still need to get it, who knows how long the antibodies would last. And so I did take it. As far as your question, did I have any untoward incidents or side effects from the vaccine? My answer is yes. From our hospital, this is not scientific. This is just like anecdotal reports, right? People who have been previously infected and had antibodies reacted worse than people who have not been infected before. Mm-hmm. So my coworker and I have both been infected both have antibodies. And we decided to take the different vaccine out of curiosity. So she took Moderna, I Pfizer, and both of us are sick. It's like flu-like symptoms, while all the rest of the coworkers who never had been infected before, so half of us took Pfizer, half of them took Moderna. None of them developed anything else. Like apart from the sore arm, that's it.
Cool. Interesting. How about Jack?
Oh, well. I received my vaccine, it's the Pfizer brand, at the very last week of December. And it was just because I was at the bedside, and I had the opportunity to receive one. Side effect wise, at first it was just that sore arm, but otherwise it did manifest to more flu-like symptoms, body aches, malaise, all that. But it went away in one day. I covered myself in blankets, sweated out. And the next day you feel perfect.
So how many days was that?
One day altogether. As far as feeling all that malaise and the aches.
All right. So for the information of the public, I looked into the data published by the EUA for both vaccines. So these are publicly available data from the FDA. The document stated that the common side effects are injection site reactions. You will have arm swelling, pain, something like that. Fatigue, headache, muscle pain, chills, joint pains, and possibly fever. Now, the more severe reactions include allergic reactions. And allergic reactions can happen with any food or medication. Our listeners have to know this. This is very important. If you receive the vaccine and suddenly break out with hives, skin lesions, especially if you develop difficulty of breathing, you should seek medical care immediately. And if you have difficulty of breathing, respiratory distress, you should call 911 because it may be a life-threatening situation. The main difference between the Pfizer vaccine and the Moderna vaccine is that Pfizer has been approved, well, not approved. It has been given EUA. This is very important information. The vaccines have not been totally approved. EUA is just emergency use authorization, which may be revoked at any given time. So the Pfizer vaccine has been given EUA for 16 years old, for individuals 16 years or older, while the Moderna vaccine has been given EUA for individuals 18 years or older. And for both vaccines, there is insufficient data for pregnant and lactating women. Also, if you have a specific medical condition that makes you unsure whether you should get the COVID vaccine, you have to seek medical advice from your healthcare provider. Going back to our panel. So Cassie told me that she opted to delay receiving the vaccine. So this question goes out to Cassie first, and then the rest of the panel can jump in. Did you have any qualms or concerns about taking the vaccine, and what factors facilitated your decision to take or opt out of the vaccine? Cassie?
So since December 16th, Bellevue Hospital has been offering the vaccine to people 60 and older in the emergency department and the ICU, regardless if you're bedside or not. And then on the 17th, they offered it to anyone in the emergency department or ICU if they're involved, whether you're bedside or not. So I've been able to get it since the 17th. However, I haven't gotten it just because I feel like I haven't done my research. I wanted to see my other coworkers get it first, see how they felt. I've been waiting for them to get the second dose to see if they get more side effects with the booster, to see how they do. Because the first one, they were okay. They said they had the sore arm. Some of them had some body chills for a day or two, like how Jack was saying and how Lynn was saying. Some of them had COVID before, but I haven't noticed that they had worse symptoms with the vaccine because I haven't specifically spoke with them about that. But mostly just do my own little wait and see how they feel.
Cool. the rest of the panel can jump in.
Just waiting for how other colleagues do and seeing for ourselves. I've heard that a lot, which makes sense. It's personal decisions. But for myself, I chose directly to get it as soon as possible because I have elderly parents. I myself is immunocompromised. I have nothing to lose if I get it. Seeing how my colleagues do with it wasn't as of interest to me because if something major were to happen, I would have heard about it by now. So that's why I went ahead and just got it as soon as I could.
Mm-hmm. And Arlene somehow discussed her situation earlier, so she actually got it, and so she didn't want to get it because because of the limitations. I mean, and the public has to know this, you are not getting the vaccine as of now because there's a finite number and the government is prioritizing healthcare workers to get the vaccine first. Well, anyway, so it's
had antibodies. That's really why I was like a little bit hesitant to take it at first. I felt like I'm already immune to it. Let other people who don't have immunity to it get it. But in the end, I just decided, okay, every single one of the frontline nurses have been offered. Our janitorial services have been offered. Our kitchen department have been offered. At that point, I told myself, like, look, there's still like extra doses to go around, and okay, I'll take it at that point.
Well, that's really, really generous of you to think that way, Lynn. Anyway, so I mean, let me just point out what the vaccine does. Okay, so when we talk about vaccination, it's injecting a very, I should say, a very mild version of the virus. It does not have enough virus to actually cause COVID-19, because I've been getting questions from friends like, oh, can I actually test positive after I get the COVID vaccine? And the answer is no, because if you get a positive test, it means that you got COVID, period, and the vaccine has got nothing to do with that positive test. And so what that means practically is that if you get the vaccine, it doesn't mean that you will get instant protection. You still have to do social distancing. You still have to wear your mask, because it takes some time for your body to develop immunity. And in the case of Lynn, she already got that immunity because she got exposed from the disease early on. And so that is very important to know. This concept of vaccine acceptance is very crucial because a Gallup poll dated November 2020 showed that only 58% of Americans are willing to receive the COVID vaccine. And this poll somehow corresponds with the attitudes of healthcare workers. So I looked into a cross-sectional study by Shikar and colleagues. So this is a preprint of the manuscript, which is available at the MedRx IV Journal website. You can look it up. They conducted a survey of close to 4,000 healthcare workers nationwide and found that only 36% were willing to take the vaccine immediately as soon as it is released, while 56% of healthcare workers were not sure or would like to review more data. All right. Vaccine acceptance increases with age, education, and income level. So it means the older you are, the more educated you are, or the higher your income, the more likely you are to accept the vaccine. And it's also important to note that the survey was conducted between October and November last year. So attitudes could have changed since then. But the point I'm trying to make is that there is a significant level of vaccine hesitancy, even among healthcare workers, and understandably so, because of the reasons cited by the article is that it was produced too fast. All right. Anyway, this leads me to my next question to the panel. Can you describe the attitudes of other healthcare workers in your unit or hospitals about the COVID-19 vaccine? Anybody who would like to?
Okay, so I guess I'll go first.
All right.
When it was first announced to us, beginning of December, that the vaccine will be made available to us by December 15th, there was like a whole buzz all across the hospital. As you guys know, we are a big hospital. We have roughly around 45,000 full-time employees. Right? So there's like a big buzz about that. Who's going to get it? Should we get it or not? There was like a lot of hesitancy. We did a lot of like town hall meetings across the hospital, and we polled the staff. Would you be interested to take it if it was offered to you? At that point, more people, I'd say about 60%, they instantly said yes. Like, yes, although I'm a little bit hesitant. Yes, I'm a little bit scared, but yes, I'm still going to take it, bottom line. Right. So what the hospital did was invited infectious disease doctors, specialists in this field to answer questions from staff, frontline staff. And I'm not talking about just nurses. Like, these are all staff, like janitorial services, security department, everyone in the hospital had a chance to participate in these town hall meetings. They did town halls for the night shift, for the morning shift, like for everyone, right? So I think that alleviated a lot of the anxiety of like the staff. And as of today, as of this morning, our institution already vaccinated 32,865 of our staff.
Wow.
So
Impressive.
that's significant number, right? As of this day, right? So that's a whole, I could safely say majority of the staff had been vaccinated.
Mm-hmm.
Now, do I know people who refuse to take it? Absolutely. Yeah, I know a bunch of people who are super educated and still had like hesitations for it. But I think some of those people have hesitations because they were like rumors of like fetuses that has been used to test like whatever fringe ideas that were circulated. I think that kind of scared a lot of people. So for the religious people, I find them a little bit more on the hesitant side, like very devout Catholics. Some of them didn't want to take it, right? And very few, honestly. I think the town halls did help.
Mm-hmm. Wow. Interesting. How about Cassie? What are you hearing among your colleagues?
So when we were first offered, we had webinars. I guess it's like the equivalent of your town meetings, Lynn, of like information about the vaccine. But from my coworkers, I think a lot more from my friends in the ICU have taken it than my friends in the ER. They were more hesitant, especially because our ER was an open area. So like during COVID, we were all PPE'd up and like the whole ER was just COVID. So because of that, we were more hesitant. We were like, we're all already exposed. Like we were like swimming in it is what we called it. And so we were like, oh, we can wait. Like it's because in the ICU, they have like glass doors to separate the patients from everyone. So we were more hesitant, I believe, in the ER. And like some of them are like, they don't feel like it's necessary yet. They don't know what like mRNA vaccines are for, because it's like a newer concept than like what current vaccines we probably use for other diseases. And we weren't as ready for it, I guess.
Mm-hmm. So would you say that there was a difference between nurses and doctors versus other frontline workers, maybe janitorial staff or whatever? Like, did you observe that or no?
I know a lot of doctors have gotten it. The older doctors, like some of the newer doctors, I've heard. I don't know. I haven't spoken with them, but I've seen that they've gotten it through like Instagram. They all have like the post, and then, but I'm not sure about janitorial staff because they house the food staff or the ancillary staff, like pharmacy, because they come through, but they're not like primarily.
And Jack, any thoughts?
My colleagues in the MICU are pretty receptive about it. I only work once a week, so I ask, "Did you receive yet?" No, and then I'll ask again next week, and it's usually they've had received it. And besides nursing, the doctors on our unit have had it. Because especially in the MICU, they're coming with us already with the ARDS, with the sepsis, and then they're really sick. So if you see that terminal end of it, if you have an option to get the vaccine, we jump on it.
Right. So, I mean, I've been hearing a lot of, I would say, crazy, for lack of a better term, crazy like ideas as to what the vaccine would do. Like, I mean, the most extreme maybe is that they're saying that the vaccine has microchip, which could be used to control the individual. And
when you wake up as a reptile.
Right. Just so outlandish what the conspiracy theories are. And so like, I feel that it's really important for us to bring the word out there that, this does not cause you to become a reptile. Pretty much. And it don't have microchip in it. I'm like, where are this information coming from? I mean, the point that I guess we're trying to make here is that there is data. I mean, hesitancy is okay if you want to check the facts out. The facts are out there. You can do a simple Google search, but do not Google blog sites and unverified sources. You have to go to legitimate websites like the FDA. It's all out there. The safety and efficacy data, you could access that, and you could look into government records as well as the studies, the peer-reviewed studies that are out there. Okay, so
it's actually a good article published by the New York Times. So Randall, as you were saying, like to Google and like sources of information on the vaccine, the New York Times actually published a good article on both Moderna and the Pfizer vaccine. And I remember those articles were put into our hospital website for our staff. So for people who have questions about how the vaccine works, we were able to access that articles, and they were very informative.
Right. I mean, I guess it's really, especially for us in the New York metro area, I mean, it's not much of a problem because as what the study which I cited earlier stated, the more educated you are, the higher your income, the higher your educational level, vaccine acceptance tends to be higher. It really becomes a problem for those individuals who are not in that particular demographic which I mentioned, that they are more prone to be misinformed about what the vaccine does and what the effects are. And so it's really important for us nurses to be reaching out and teaching pretty much that this vaccine is safe. All right. Does it mean that it's 100% safe? Of course not. There are untoward effects that could happen, but by and large, this side effects, this untoward effects are very, very rare because this is a medication, right? Any medication that you take, there is an expected side effect, and there are also untoward side effects that could happen. Anyway, so this leads me to my last question what do you think? What other things would you advise or would you think of to increase acceptance of the vaccine? And Lynn mentioned about town halls and putting up articles in the medical units. How about on a public level? I mean, how do we make this work?
I think accessibility will be a big one. When they open up to the hospital staff, they were only vaccinating a certain time period throughout the week, Monday through Friday, business hours. If they make it more widely available, I'm sure people will show up, make it more convenient.
Mm-hmm. Right. And Cassie, any thoughts?
So one of my coworkers actually said to me, if we didn't have to make an appointment and they actually came to you with the vaccine, he would be like, yes, sign me up. But it's more of the idea that he has to make an appointment, schedule it into his day, and have the time to actually go and leave the unit to go get it. If you're busy, you're gonna be like, oh, I'll just skip it for now. But if they're there, then you're just okay, go.
Mm-hmm.
And I believe if it's accessibility, and it's also people just need to know more about it. If it's to younger people, maybe New York Times is not their source of information, whatever younger newspaper, I'm not sure, but some other news source for them.
So are you thinking of TikTok, things like that? Oh, you're the youngest in this group. So I mean, maybe you're the best person. Cassie, by the way, is maybe in her early 20s. So right.
So I'm 24. So I follow medical influencers on Instagram at least, and they do some pretty informative Instagram, TikTok videos on it.
Yeah, I mean, I never thought about that actually. Use of alternative media like Instagram or TikTok, which is very popular among the younger segment of the population. I'm not sure when the general public will get access to the vaccine really, because I went into the New York City plan on vaccine distribution, and we are still in phase 1. I mean, phase 1 is healthcare workers, and second would be residents of long-term care facilities. Before, and it's 5 stages before it is widely distributed. So it's not perfect. We can do better, but at least it's good for a start. Well, anyway, I would like to thank all of you for being here. Time flies when you're having fun. I'd like to thank our panel, Lynn Mendoza-Silverman, Cassandra Lee, and Jack Say. And this has been Healthy Mondays with a Pina of Nevada. Thank you so much for being with us. Take care. Bye-bye.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with a Pina of Nevada.
Just like a friend from back home.
This is your Filipino radio experience in Las Vegas. PHLV Radio.
PHLV Radio.